morning. We're here in the School of Information and Library Science this morning with Professor Stephanie Haas. Stephanie is a professor here who specializes in a number of things, but one of her areas of research is natural language processing. Let's begin with just tell us a little bit about your many roles here at the School of Information and Library Science at the University of North Carolina at Chapel Hill.
Well, that, of course, is one of the fun things about being a professor, is there are so many. Teaching is an important one. Mm-hmm. How is it that we are going to get the people we need in the right place in the right time to deal with this intersection of people and information and technology? That's what information science is all about. Teaching goes on in the classroom, teaching goes on an individual basis, so we have doctoral students who need very careful individual attention, as well as the large classes doing basic things like systems analysis, one of the things that I teach, database design, another one of my favorite classes. Research, of course, is the other big piece of time, and that's where the interesting questions get posed, and we'd like to answer them if possible. I'm interested in natural language processing. Roughly, how do we get computers to do useful things with the language that people use every day? Computers are really good at numbers. They're really good at very structured kinds of things, databases, for example. But once you move from a planned, here's how we're going to represent this information in fields and numbers and so on, computers aren't very good at that yet. So we have a number of ways of dealing with them. That's the broad definition of natural language processing. I'm particularly interested in the words that people use to express what they're interested in. Sublanguage is a broad term for what is it that experts use to communicate about the things they're really interested in. And we all get exposed to it, whether we want it or not. When you go to the doctor, talk to the auto mechanic, talk to somebody who's got a really exciting hobby like scrapbooking. There's a whole language around that. The terms, the structure of the language, and in the background, what are the concepts that people need to talk about? So we have this idea of general language. It's an amazing way of representing information. It works surprisingly well with people who have very little in common and can talk about things.
Right.
But that's not enough. Once you get into an area where you're an expert, you have to have different kinds of language to talk about it. What are the concepts? What are the distinctions? If you've ever wandered into the store where you shouldn't have been, the scrapbook store or the hardware department, they've got little things that have special names for special purposes, and if you need to know that, you'll learn it.
Right.
And if you don't, you say, I want one of those pointy things. Well, that's not good enough for expert communication. So that's a sublanguage. It's got terms, it's got understandings of functions and relationships and means of expressing that. It seems to come about fairly naturally. When experts are talking to each other, they don't want to use things like, no, not that pointy thing, the other pointy thing. That's not efficient. It's not very precise. And so these sublanguages arise. They also have needs for types of communication. So the idea of genre comes into play as well as just the words. A genre, well, we're all familiar with genre in terms of what kind of movie do you want to see tonight, a comedy or a musical or a horror film. But we can also think about genre in the information world as being a kind of document or set of information that has a particular form, an expected form, and content and function. So somebody who is an expert in writing patents knows what information comes where, what kind of language do you use for it, and what is somebody else going to be looking for in the patent. The prescription that your doctor writes and you take to your pharmacist, that's a particular genre. It's got a structure, it's got very specialized language that occurs in it, and the two of them use that to communicate. In some ways, we're almost an interloper peering in on this expert communication, but we have to be able to understand that in order to follow the directions and understand what it is that we're taking. So if we've got this idea of expert communication, it's got jargon. That's not a very complimentary word. We can just call it terminology if we want to be more useful, more neutral. So the specific words and phrases that people use. We've got this idea of the genre. How is that going to be organized in order to be used? And then the other pieces of the language. How are relationships expressed? What's considered grammatical? And we've got this idea of what good language sounds like. But if you listen to two auto mechanics talking about a tricky repair, it's not going to sound the same way that two physicians consulting will sound, or the way two English teachers will talk about grading papers or whatever it is that they're talking about.
So genre is sort of like a template then. It's more of a structure, so it can be XMLized. Is that sort of the way?
Well, as much as any language, natural language could be. But if you think about the genre of the business letter, back in the days when we had business letters, you expect a heading and a date and perhaps some kind of introductory paragraph and maybe a courtesy closing paragraph. But then there are these things called of whatever it is you want to apply. And in fact, there's a whole discipline of writing functional language. So if you're a doctoral student from some other country, European country, China, wherever, how do you learn how to write a request for a reference for an American university? Do we just know how to do these things naturally? Obviously not. So it is something that can be taught with, here are the expected pieces that should be there. And when we get a letter requesting a reference that doesn't have all of those pieces or phrases it sounds funny and strange, and we may even think it sounds suspicious in some ways. How do you know somebody's an expert? Because they sound like one. Now, of course, jargon by itself or terminology by itself does not guarantee expertise. And that is one of the things I think that information science can do to help just plain folks, as one of our mutual friends used to call it, just the ordinary non-expert who suddenly finds themselves in the midst of an expert's world. Because jargon can be used to hide information, can be used to confuse. But if you find yourself in this expert world and you're a non-expert, how do you know what to trust? How do you know what's authoritative? How do you learn what you have to learn before you can understand what it is that you need to understand? And that's, as I say, something that I think information science can do, because we're faced with this more and more. Suppose you are back with your doctor and he or she tells you you have something. Do you want to find out more about that? Well, one of the things that the web has allowed us to do is to learn more about some medical conditions that we or a family member has. That's one of the most common places where we start running into information that is authoritative. It may be very, very important. We've got a lot of motivation to learn about it, but there's that big barrier of the language. And of course, language is just covering up all of those concepts and understanding of what's really going on.
Right.
The web has made that expert level information in the medical journals, most prestigious medical journals, easily available to us. But there's a big barrier, and the language, the expert language that's used, is a barrier in and of itself, and it hides the barrier of really understanding what's behind it. If you've taken out a credit card recently and actually read the credit card agreement, interesting thing about credit card agreements, I was reading one the other day. We all know what the balance on our credit card is. Well, in that agreement there are actually the new balance and the total new balance. I'm signing my name to this thing and saying that I'm going to do the right things by these. I think the new balance is just what accrues over transactions during a month, and the total new balance throws in the penalties and fees and finances charged. It's not clear to me. That is a document that is supposedly written by experts for consumers. And yet you need to know an awful lot in order to understand what your risks and responsibilities are. So medical care, the automotive, financial industry, trying to get new cell phone service, setting up the cable service, we all run into the language, the jargon, the understanding, just in trying to live our ordinary everyday lives. So in one sense, we have this opportunity to understand what expert language and ideas are, to really get authoritative information from the source. And on the other hand, we have this jumble of words and languages being forced on us necessarily whether we want it or not. And yet we have to make decisions based on that. So...
This is fascinating. I mean, you've sort of defined an important role for information science as being the intermediary between these multiple sublanguages and ordinary human language.
I think we've got a real role for both identifying what the risks and responsibilities of, I'll simplify it, the two parties, the information provider as well as the information consumer, but also the opportunity to understand really what's going on in the language world, in the information sharing function of this, and therefore what kinds of tools can we recommend to do so. So if you're a provider, what are your responsibilities? You know who your intended audience is, and are you really serving them? And an interesting, and clearly we're getting into ethics fairly quickly, which I'm not going to do. If you are an expert writing for an expert audience in your own field, you should be allowed to make all of the assumptions about the knowledge and expertise of the people you're addressing. Do you have any responsibility for the consumer who strays into your, what you thought was your private enclave and is making important decisions based on that? Do you now have to create two copies of everything, one for the experts and one for the just plain folks?
Right.
And of course, as a consumer, we have to take responsibility for understanding the risks that we have. And the problem is we don't have the tools to do that well. Some places provide glossaries for those special terms that you run into. A glossary isn't necessarily enough, and a glossary may make things just as confused as you were in the first place. I was looking at the IRS website, where I very quickly found, without even a lot of work, 10 definitions of income. We are filing forms and signing our names on the taxes based on those definitions of income. On the one hand, we need to be able to understand when we are straying into the expert enclave so that we can take what those precautions are. But on the other hand, we need to have some ability to find the glossaries, to get the starter documents. Where is the tutorial for buying cable service? Well, the cable company doesn't really necessarily do the best job for you. What can we do? I think awareness on the part of the provider and the consumer is one role for information science. What are those situations under which this is going to occur? Should we have a stamp saying warning expert content? Well, we have good housekeeping seals. There are various ways we could identify an expert website, understanding that it's not just jargon that's the sign of an expert. A jargon can be the sign of a non-expert trying to do a good snow job as well.
Exactly.
So if we can provide a better framework for understanding what those situations are and raise the awareness of the participants, assuming goodwill on both parts of the participants, then I think that's one service that we can do. I think then we can also start to look at some more technical solutions. If we are finding and straying into this information on the web, then what can the web do? Can it link to tutorial sites? Can we provide better links? Even simple things like mouseovers with real definitions written for just plain folks, not for those experts by experts. And there's a lot of that kind of interlinking that's going on already. Crosswalks of saying, all right, here's this list of special terms, and here's a set of terms that you may be somewhat more familiar about. Let's do those links and say, this is an exact synonym. This one, not so much. There are some specializations going on, and here's what those actually are. The barrier to that is how many people does it take to define every word that any expert uses? It's never going to happen. So then we can start to come into maybe social tagging. Here's my play of, I had to actually go through this article, and I had good reason to do so. So here's my translation. Yes, I'm a non-expert, but I was motivated to provide this. This may help you. If you look at something like Wikipedia, there's a lot of that kind of information in that way that's acting as the bridge between the expert and the non-expert audience. I think of this as a translation problem. It's a little different from the kind of translation you might think of, Spanish, English, or Japanese to Chinese, whatever, because the worlds themselves differ. If we're doing translation of a restaurant menu, yes, the dishes may differ, the ingredients may differ, but it's food intended for human consumption, and there's a fairly basic level of understanding and agreement there. Word-by-word translation, when it's body parts doing interesting things that are making me sick, there's a lot more behind that than just telling me that carcinoma means cancer. There's a lot more behind that. And that's the tricky part of the translation, not just the term translation, but the concept and relationships, the implications, the assumed knowledge of what makes an expert in the first place. That level of translation, I think, is the hard part.
So there's this important sort of educational function that these intermediary services would presumably provide. I know you've done some work with the glossaries, animated glossaries, as well as glossaries, as you pointed out earlier, with the sort of the pop-ups with definitions. I mean, what are the real sort of challenges there? I mean, we have a lot to learn, don't we? We haven't solved it.
There is a lot of work to learn. We can start right from the beginning. What terms need to be defined in the first place? And that is dependent on what audience you're trying to work with. When we were working with the Bureau of Labor Statistics and others on statistical terms, a definition of a seasonal adjustment that is suitable for a college-level statistics major is not sufficient for somebody who's trying to figure out whether unemployment is getting worse or not. And certainly not good enough for a middle school student who's just figuring out, look at all of these numbers and I'm supposed to know something about it for an end-of-year test. So audience is one of the big pieces. What are the words and who are you trying to aim it through? It would be nice to say that one definition would suit all, but I think that's one of the problems. Then you have the idea of learning styles. Animations, diagrams, words, more words, which words is another problem. Certainly in the United States, third or fourth, I can't remember where I am, problem is the real natural language. Do you provide the same explanation in English, in Spanish, in however many languages you need to have? That gets into policy and sometimes heated policy discussions as well, especially if it's information being provided by some kind of federal or state or local agency, because money has to be involved in order to make these tools. Hospitals run into that in terms of translation. You go to the emergency department, who do you want to have translating for you if you are not a native speaker of English and there is not a good translator? We run into this very serious risk of parents who do not speak English, but their children are in school and do. Do you want your 9-year-old translating exactly what your medical problem is? And can they really do that? And is it fair to the child? So it starts out as a linguistic problem, but quickly gets into more of a societal issue of what decisions are being made and by whom. How do we triage to get the most important translation services, if I can use that, best? And where can we do it automatically or semi-automatically? Where can it be done by computer? And where do you really have to have a person involved?
So the I know you've done work with emergency room languages. Can you talk a little bit about some of the results of your research with Debbie Travers and others? And I mean, this is fascinating stuff. I mean, both from a linguistic point of view and information science point of view, but then from just a practical surveillance sort of point of view.
Very practical. So Debbie Travers, who's got her PhD at SILS and is now on the faculty at UNC School of Nursing, started this in terms of trying to understand what is it that people say when they come and tell the triage nurse what's wrong, and what then gets passed along through the medical record. We have electronic medical records more and more. We did a survey in 2003, I think it was, and at that time less than half of the hospitals in North Carolina were collecting that information electronically. Now it is growing and will soon be essentially universal to have. That's very valuable information. But it's messy because it's collected in this wonderful natural language that the patient uses, or the patient's companion uses coming in, but that somehow has to be translated to something meaningful for the emergency room clinicians to say, who's got the most urgent thing to come next?
Right.
And so this short description of the chief complaint problem and then the triage note a little more has to be able to translate between someone who says, my mother fell out in church this morning and we don't know why, to understanding that that means she fainted.
Right.
And going the other direction, if a triage nurse actually said, well, have you felt syncopal recently? Which is syncope, meaning you fainted or felt faint. It's not meaningful.
You saw the puzzled look on my face. Yeah.
It's a very interesting phrase. So fell out, faint, syncope is moving from regional dialect to a fairly standard term that we could expect most people to understand to a technical term that would eventually show up in the record. All of those are meaningful. Whose job is it to do that translation? We can't expect the patient to do it. There's discussion in the emergency medicine field as to whether it should be translated at all. Patients' own words are very important and very descriptive. But is that really going to address that? Who do we take next?
Right.
Going further, those same records, they're very timely records. In North Carolina, they're collected every 24 hours. So for any kind of surveillance, bioterrorism, public health, biosurveillance for flu outbreaks, for little nasty intestinal bugs, all of those things that we'd like to keep a track on. That's the most timely data that we have.
Right.
And yet, if you want to count in the last 24 hours how many people had symptoms that would indicate some particular problem, you need to be able to say all of these terms mean the same thing. However they were recorded, however they were expressed, whether they're very compressed abbreviation, whether they're full text, here's what the patient said, but we know that this really means. There's a great deal of pre-processing that has to be done before you can do something as simple as saying, we saw so many patients with this group of symptoms yesterday.
Right.
And that's such a fundamental problem that it's not clear as how nasty it can get until you see the beautiful creative language that triages do. Nurses have. They've got 2 minutes to say, here's what's going on, or here's what the patient is reporting.
Right.
And we need to make that as easy as possible. So as we're working towards perhaps a controlled vocabulary for recording chief complaint, the primary concern is it has to work at triage.
Right.
It's got to have enough words in it so that they can express what's necessary, not too few, not too many. It has to work with hospital information systems. It's a big order, and we've got a lot of people who are interested in it, from the surveillance, from public health, from education. If you've got a resident in training in the emergency department, how do you make sure that that person's got enough exposure to different kinds of language, different issues? You want to see what have they been faced with. Let's count up how many cases of this and how many instances of that. A lot of people who are talking about this, we'll see where that comes out in the next 10 years. But I think that particular piece will make some progress.
So why can't we just put microphones there and just record everything and let the machine automatically classify all this stuff and
into what?
And to take care of it all?
Yeah,
for
that
us?
would be great, wouldn't it? This why can't we get the machine? Well, there isn't even agreement on what the machine should be classifying it as.
Right.
So how many concepts how many concepts is it important to have? We've worked with one hospital that had a controlled vocabulary of about 60 words and another one that had 1,400. Probably someplace in between there.
Yeah.
So what are the important distinctions? So we're back to this expert idea of what are the important distinctions there. And then there is, how is it going to be expressed? What does elephant on the chest really mean? And yet that is a common expression for what it feels like. I felt like I had an elephant on my chest and I couldn't breathe.
Right.
That's a tricky one,
Mm-hmm.
to do that translation to something that's meaningful. And I would, when I first started out in this field, I thought maybe we could really get computers to do understanding of natural language so that we could do this kind of classification or sorting, or here are all of the things that are talking about X, Y, and Z. Now I think it would be a shame if we could, because that would imply a lack of creativity in human language. And that's one of the great things about working with language, is because people are so creative. Spooey. Do you know what a spooey is?
No.
It's a single point urban interchange, and it is a particular design for highway entrances and exits that takes up less space than the general cloverleaf that we typically imagine. What a lovely term. What a wonderful idea that there are people in this world who design highway interchanges. And that's all hidden behind SPUI, S-P-U-I. Wouldn't it be a shame if we didn't have that?
Some people might argue that it would be better.
The concept or the term?
The term, yeah, right. The concept, yes, we want the concept.
Even highway engineers need to be able to make that distinction between a cloverleaf and a spooey.
That's right.
The rest of us just say, you know, that exit with all of the gas stations at it.
Yeah.
And that's sufficient.
Well, I can certainly tell by your enthusiasm for not just this topic, but explaining things, why you've won multiple teaching awards and why your students are so fond of you. These examples are really good ways for us to understand what is it that people in this field do. I mean, it's not a matter of just saying, you know, it's how do I retrieve something, but the retrieval is only a piece of the action. And I think some of your examples and this work on natural language processing certainly illustrates some of the breadth and really fascinating aspects of this kind of emerging field of information and library science.
One of the things the web has done by putting all of this information available to anybody, that's an exaggeration, of course, is it really makes some of these problems come right in your face. Because it's now our responsibility to find what that credit card agreement means, what that medical information needs. And I think that's a big shift over the last several years, is the information seeking and the information understanding being our responsibility. And that's why I think it's important that information scientists do the right thing and try to make it a little easier for people to understand and find.
And I take it you're optimistic that we'll continue to make progress in this area.
Yes, I am.
Are there other things that you'd like to add at this point? This has been really, really helpful.
The examples are fun. That's one of the reasons why language is such a good way to get people into this whole idea, is because everybody uses language.
Fantastic. Thank you very much.
Thank you. Been a pleasure.